Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Wbhrb Staff Nurse Grade 2 2025 CVT based question answer Part 9. Let's start. The first question. What is the full name of ELISA? Option A. Enzyme licensed immune solution activity. Option B. Enzyme linked immune sorbent assay. Option C. Enzyme linked integrated solution activity. Option D. Enzyme linked immune solution assay. The correct option is option B. Enzyme linked immune sorbent assay. Live attenuated vaccine is dash. Option A. Polio, OPV. Option B. Diphtheria. Option C. Tetanus. Option D. Anthrax. The correct option is option A. Polio, OPV. Protein deficiency disease in children is option A. Kwashiorkor. Option B. Marasmus. Option C. Goiter. Option D. Both A and B. The correct option is option D. Both A and B. Within the cardiac conduction system, which structure is recognized as the primary pacemaker responsible for initiating each heartbeat? Option A. Sinoatrial SA node. Option B. Bundle of His. Option C. Purkinje fibers. Option D. Atrioventricular node AV. The correct option is option A. Sinoatrial node. Which of the following correctly represents the chronological order of human development during gestation? Option A. Embryo, zygote, fetus. Option B. Fetus, embryo, zygote. Option C. Zygote, embryo, fetus. Option D. Zygote, fetus, embryo. The correct option is option C. Zygote, embryo, fetus. The most common congenital heart defect is option A. Tritology of Fallot. Option B. Ventricular septum defect VSD. Option C. Atrial septum defect ASD. Option D. Coarctation of aorta. The correct option is option B. Ventricular septum defect VSD. Which oxygen delivery device gives the most precise FiO2? Option A. Nasal cannula. Option B. Simple face mask. Option C. Venturi mask. Option D. Non-rebreather mask. The correct option is option C. Venturi mask. The antidote of morphine poisoning is option A. Atropine. Option B. Naloxone. Option C. Neostigmine. Option D. Diazepam. The correct option is option B. Naloxone. In COPD, the drive for respiration is primarily regulated by option A. Cerebral blood flow. Option B. Oxygen levels. Option C. pH level of blood. Option D. None of the above. The correct option is option B. Oxygen level. At least time of hand hygiene. Option A. 90 seconds. Option B. 20 to 30 seconds. Option C. 1 minute. Option D. 2 minutes. The correct option is option B. 20 to 30 seconds. A nurse is taking care of a patient with DVT and she must be aware that venous emboli will be locked in option A. Heart. Option B. Lungs. Option C. Liver. Option D. Kidneys. The correct option is option B. Lungs. Patient on enalaprine and diuretic therapy for heart failure. Nurse should notify the physician that the therapy is not effective when she finds option A. Dry cough. Option B. Skin rash. Option C. Edema legs. Option D. Posterior fall of BP. The correct option is option C. Edema legs. The normal duration of puerperium is option A. 1 week. Option B. 2 weeks. Option C. 6 weeks. Option D. 3 months. The correct option is option C. 6 weeks. What is the term for delivery before 37 completed weeks? Option A. Postterm. option B, preterm, option C, term, option D, abortion. The correct option is option B, preterm. The most common cause of cerebrovascular accident stroke is option A, cerebral aneurysm rupture, option B, hypertension, option C, arteriovenous malformation, option D, thrombosis or embolism. The correct option is option D, thrombosis or embolism. Water-soluble vitamins are vitamin dash. Option A, vitamin A, option B, vitamin D, option C, vitamin B, option D, vitamin K. The correct option is option C, vitamin B. CPR should be started when option A, person is bleeding, option B, no breathing and no pulse, option C, only unconscious, option D, having chest pain. The correct option is option B, no breathing and no pulse. Before administering digoxin to an adult, the nurse must withhold the drug if option A, apical pulse is 64 per minute, option B, blood pressure is 100 per 70 mmHg, option C, apical pulse is 48 per minute, option D, respiratory rate is 20 per minute. The correct option is option C, apical pulse is 48 per minute. A patient with head injury has clear fluid leakage from the nose. What is the most appropriate nursing action? Option A, suction the nasal fluid. Option B, taste the fluid for glucose. Option C, insert nasal packing. Option D, administer antibiotics. The correct option is option B, taste the fluid for glucose. All are the organs of lymphatic system except option A, tonsils, option B, thymus, option C, spleen, option D, pancreas. The correct option is option D, pancreas. Thank you for watching. Please like and subscribe.